Let me just shut this.
And welcome to another Veitengruber Law community chat. I am George Veitengruber. I am happy to be joined today by Dr. Sue Massie, who is a naturopath, and she will start off by telling us exactly what a naturopath is. Hi, Sue. Good to see you today.
Hi. Good to see you as well. Thank you so much for having me.
Of course.
A naturopath
Thanks for coming on.
Naturopath, is a holistic doctor. So basically what I do is I teach people how to detox, cleanse, nourish, and rebuild their bodies. And that's with vitamins, minerals, supplements, things of that nature. So I am not a medical doctor. I don't diagnose or treat, but I teach. That's basically what it is.
That's really excellent. And what got you into a naturopathic way of treating people?
Well, 25 years ago, back in 1995, my husband became very ill with very crazy kind of symptoms, and couldn't figure out what was going on with him. And it turned out through his buggy eyes, radiating jaw pain down into his chest. And then his heart would race 240 beats per minute, and then he would be exhausted for like 2 days. And we went to emergency rooms, we went to all kinds of doctors and so forth. And the bottom line is we found out that he had Lyme disease. So through that, about 6 months, 8 months into his diagnosis and started treatment, the doctor suggested to me that I had it. And I was like, you're crazy, I don't have this. And then it turned out I had a lot of symptoms that came on suddenly again, but turned out I was bit by another tick going on a camping trip with my daughter. And then I became very symptomatic and very sick. So we both started rounds of antibiotics. Then we had our kids tested, they were positive. And I have 6 children. So it was chaotic, it was crazy. So after doing antibiotics for 5 years in a row, I became paralyzed. And through that, I just said, I'm done. I felt toxic. And I said, I can't take one more antibiotic, one more drug. And that's kind of how I started with all this.
I had a similar issue with antibiotics. They thought I had acid reflux for about 3 years, and it would come and go. And the doctor didn't spend much time going into a thorough analysis of what was going on. He just said, it sounds plausible. So I would go through rounds of antibiotics and steroids just about every 6 months, like clockwork. And at one point, the feeling got so bad that I was getting laryngitis. And they thought it was chronic sinusitis at the time,
right?
Misdiagnosing the acid reflux. But when I shifted doctors, suddenly within 10 minutes, the proper doctor was just like, I could bet you any amount of money that you're dealing with acid reflux, and what's happening is that the acid is burning your throat out enough that you are feeling horrible. But then they were giving you the steroids that would bounce back you temporarily, not factoring in the domino effect of all of the crappy things I did to my gut by taking all those antibiotics consistently over a 3-year period.
Exactly. And that's exactly what the problem is because what they're doing is they're putting Band-Aids on the symptoms. What a naturopath does is I go to the root cause. And when you look at it, you're exactly right. Sinusitis, which is inflammation up in the sinuses and so forth, can come from either bacterial or fungal infection. But it also, what a lot of people don't know, it's directly linked to the small intestine. So you're like, small intestine. Now we're talking about digestion, okay? And having dysbiosis or an upset in the GI tract, the gut, that's the person that eats and they can eat very little. because they can't eat a whole lot, or when they do eat, their stomach starts to hurt, or they feel bloated and you just feel awful. And you're like, what is wrong? I can't eat anything. That's typical, but that sinusitis is directly linked to that small intestine. So this is the stuff that I'm like the investigator, and I love to go in no matter what the symptoms are. And that's what I look at as symptoms, but I don't coat the symptoms with a prescription drug, which I don't prescribe anyway, but I go to the root cause and say, what is going on here? Just as in the same way, when you have a hiatal hernia, the root cause of that is your ileocecal valve. And people are like, what is that? Where is it? So I teach them where it is. It's down at the end of the small intestine going into the large intestine, and the little valve gets stuck. And they're like, well, how do you fix that? And doctors say surgery, because surgeons sell surgery. I'm a naturopath, so I sell health, and that is taking the proper supplement to correct that ileocecal valve, which is Spanish black radish. Anyway, just a little tidbit, but these are the things that, you know, how you fix all this. And it's funny that you mentioned what you had, George, because it's exactly what my husband had. And he was diagnosed with hiatal hernia, GERD, acid reflux, and he didn't have those things at all. It's exactly what you described.
You know, and it's funny because the effect of all the other things going on, naturally they went from, well, it doesn't seem like it's GERD, but they did diagnose me with leaky gut, and for a while they wondered if I was having an issue dealing with gluten.
Right.
So they threw me on all sorts of restrictive elimination diets in order to figure it out. And as it turns out, again, this goes back to proper diagnosis and proper analysis. Once they figured out what it was, all I needed was a cough syrup to coat my throat, and then obviously went through sleep studies and all sorts of other things in order to finally get rid of the acid reflux. But all that steroid and antibiotic was useless. All it took was a cough syrup that they used to use for people with my brain just shut down. Yeah.
It's called Alzheimer's disease.
Exactly. That's it. It's the CRS. Can't remember shit.
Yep. Yeah. I get
So obviously we're in a very strange, interesting time in our world and in our lives, and a lot of people are always looking for the non-surgical, the non-prescribed medicine way to handle issues.
Right.
And that's a lot of the philosophy that you bring into treatment. Why don't you talk a little bit about that?
Okay. So what I do is I do an intake, see what's going on with the person, take a history, talk, communicate, and most importantly, I listen. Because listening is the key to this whole thing. It's not about me and my health. It's about the patient sitting before me and what is going on in your life, or what has been going on in your life. And that has to do with emotional, psychological, physical, spiritual, and, you know, in every sense. And then I get an idea of where we need to start with that particular person. Everybody obviously is different from one another. So what I do is I work on building a foundation, which is called your immune system. I evaluate what's going on with your gut, you know, your thyroid, your adrenals, which is a big one I always see due to the stress that we have today, especially what we've been going through with COVID-19 for the last 5 months and the stress that everybody's under. It just burns out the adrenals. You have adrenal issue, you have a thyroid issue. Now we're talking endocrine system, you know, and then I use various materials, you know, modalities that I have in my office. One is called a Zyto machine, ZYTO. Zyto.com. Basically, it's a electrodermal testing. So it's a lot like a lie detector test, but it's going to tell me and show me a complete picture of what's going on inside your body. And it's just amazing. And then I I go over the whole report with the patient, and then I email it to them so they can go home and review it and have a copy. So that's just one of the things I do. But from there, then I start with just a couple of things. I don't throw a boatload at people, because you can't fix everything in one day. And as I tell people, you didn't get sick in one day, or you didn't get cancer, or whatever it is you're dealing with, you know, cells gone bad. And that didn't just happen in one day. This has been, you know, over years. And what we need to do is correct. And like I say, build a good foundation. I always think of it as a burnout building. And I figure a lot of people were all burnout buildings. And what we can do is, I can't just go in and throw in new 2x4s and throw up some walls, because that's not going to work. We have to clear the foundation, build a good solid foundation, then put in the plates, and then put up the 2x4s and the walls and the insulation and the sheetrock and electrical and so forth. So that's what I do. I have fabulous machines that I've been very blessed to acquire over the past 25 years. My latest one is called an HSR. Nobody has this, and it's called a heart sound recorder. It's big out in Colorado and California, but it hasn't hit Jersey, except me. I've had it over a year. And what a heart sound recorder does is it records your tone of your heart and tells me nutritionally what is going on in your heart. It does it through a sound recorder, and it measures the mitral valve, the tricuspid, the aortic, and the pulmonary. So I can tell you what's going on in your heart and how to correct it with nutrition. And I can show people within 15, 20 minutes by giving them stuff right then and there. So it's just an amazing thing. There's a full explanation on my website, which I will talk about at the end.
When it comes to that balance of health, I've always been told that it's the combination of water, nutrition, sleep, stress, and basically finding an appropriate balance between all of those items in order to get you back to global health. And I find even before COVID, most people live their lives imbalanced, always firing on cylinders, always grabbing the wrong food at the wrong time and pushing themselves in ways they can't. What are some simple things people can do to find themselves a little bit of balance?
Okay. I'm a mother of 6 children, and now I have 6 grandchildren. And now I have numbers.
Congratulations.
Thank you. Thank you. And 5 of them are boys. So, and I have 4 boys of my own and 2 girls. So you can see life is crazy. I work full time. Plus, you know, I used to work 80 hours a week. Thank you, COVID-19. It really slowed me down and take a reevaluation of what's, you know, important. You can't fix everybody all the time. But anyway, so time is a huge issue for me. So I have to eat healthy myself. I'm 63. I've been through diagnosis of Lyme disease. I've had my whole life, which led me to a diagnosis of ALS, Lou Gehrig's, back in May of 1999. I collapsed. When I went to the doctors, they told me I had this thing called ALS, which I never heard of. And I was paralyzed from the neck down. They gave me 3 years to live. They said, you will die by 2002. I couldn't speak or swallow. I had a boatload of symptoms, which I won't go into, but the problem, the good news is, obviously, I didn't die. At the time, I acquired a Rife machine. It's RIF as in Frank E, a Rife machine. I had, again, alternative modalities that nobody had, things that are all about energy. Okay, so that was a thing. We'll talk about that in a minute, but get back to the food. So the idea was, I was one of those that I don't drink coffee, but I would get up, have a cup of tea, don't eat breakfast, or have a little cereal or something. Carbs, carbs, sugar, sugar. That's all you're eating. So, you know, I found out I'm a Ferrari, and to put it, you know, to run a Ferrari, you need that ultra, ultra supreme gasoline. So now we're talking protein. You have to have protein. And there's a lot of garbage protein out there, believe me, protein powders and stuff. But to get up in the morning, I have a protein shake every morning. It's got 20 grams of protein. It's a whey protein. I add organic peanut butter, almond butter. I add organic banana. It's chocolate. I mean, who doesn't love chocolate, peanut butter, and banana? You know, and I'll throw in maybe some walnuts or something. It's about 28 grams of protein. So it's really feeding and nourishing the cells, because your muscles run on amino acids, which is protein. Okay. And when you have digestive issues, which most people do, you can't break down a lot of proteins usually. So this is a great way of getting the amino acids directly into the body, and it keeps your engine running literally for 4 hours. You're not hungry or anything like that. Okay. And then what I find is I have to pre-plan a day or two ahead to have like a salad, you know, whether I make a salad and split it up and put it in Tupperware at this point or whatever. You have to have food ready. But even if you're eating a salad, say for lunch, you need protein. Okay, and I'm not talking about a mega protein type of diet, but just enough to keep the blood sugar down. Okay, that's why so many people have these blood sugar issues, because they wake up in the morning and their sugar, you know, they grab either coffee, donut, hard roll, whatever, and their sugar spikes way up. If you were to stop and have a hard-boiled egg that you can make the night before and put in the refrigerator, or Greek yogurt or some sort of protein, that pulls your sugar index down. So you can still have, I don't advocate donuts, but I'm saying if you're going to eat that donut, because I'm not going to be there to stop you. And, you know, we all get to do whatever we want. We have free will. But anyway, you know, if you're going to eat that donut, you have one quick egg, whether it's a hard-boiled egg that you're putting a little salt on and eating on the way to work or something, or have it at work. Now you've got protein in the system all day, so the blood sugar stays steady. And that's what you want. You don't want these spikes up and down, because when you have this type of issue going on, it's going to directly affect your thyroid, which will affect your adrenals, and now you've got sleep issues. Sleep issues have a lot to do, sleep apnea, with hypothyroidism.
Yep.
But people do these sleep studies and they get that CPAP machine, nobody's sleeping in the house and so forth, but it seriously has to do with the thyroid. It's a huge part of it, usually, okay? And then for dinner, same thing, protein and vegetables, try to stay away from the starches as best you can. And there's all the different diets, the paleo and keto and, whatever. Just eat organic whole food, basically.
I was always told that the pairing of protein with whatever you're eating is going to balance it out much better. That was some solid advice as I hit some version of recovery.
Yeah.
But I find the other thing, obviously, right, is that with this go society, a lot of people skip breakfast, but a lot of people also, as they eat whatever version of breakfast in the car on the way to their office, on the way to their meeting, then they get to while they're driving, then they get to the office and they skip for the next 8 to 10 hours before they actually find food again. So then you gorge and you're ravenous and you're not actually paying attention to what you're throwing in your body. You're just trying to find fuel.
That's it.
So,
and you pass that McDonald's or whatever is coming up and you quick pull in, grab a burger, and seriously, if you look at what's in that particular food, the fast food, quote unquote, you're eating a ton of fat, obviously a ton of salt and the wrong kind of sodium, and then you wonder why you get heavy. Here's another quick point that people don't even realize. When you put weight on, okay, it's not necessary. Yes, it's diet. Oh, you get so many calories a day, say 1,200, 1,500, whatever your calorie is to keep at your certain level. If you take in more calories than you're burning, obviously you're going to put weight on, okay? But here's the thing that people don't realize. We are full of toxins, okay? We have a toxic society. The water we're drinking, you talked a little bit about that, the air that we're breathing, the products that we're eating. There is tons of xenoestrogen, which is called fake estrogen. And we're loaded with it. Little boys are full of it, even little girls, they go through puberty much earlier and so forth. And all that and that's breast cancer, which I was diagnosed with also. Anyway, so xenoestrogen, and you're like, where does that come from? Well, it comes from all the estrogen that they inject into the chickens, the beef, all the things that we're eating. It comes from plastic. And my gosh, go in this grocery store and look at all the things that you're buying that are wrapped in plastic. And the worst is the water bottles. Today's water bottles, the Dansani, whatever water you're drinking, and you stop and get water bottles because you need to hydrate, but you're drinking out of the wrong kind of bottle because it's full of xenoestrogen. Now it accumulates in your cells. Where it goes to is your fat cells. So if everybody has fat cells, and I used to be 118 pounds, believe it or not, so I know, about being thin and heavy. I've been on all sides. But when you have fat cells, what happens is they get full of toxins. And when that toxin is full, you build a new fat cell on top of that fat cell. When that gets full of toxins, then you build a new one. So people get a lot of that around the belly, around the waist, fat cells. And that's what it is. It's full of toxins. So what we need to do is get in and bind the toxins and excrete them. And again, people don't think of this, but that buildup of estrogen and lack of progesterone is big in breast cancer. And again, I was diagnosed with that in 2005, intraductal carcinoma, and I never had chemo, radiation, and I did all holistic again. And right now, 2 months ago, there's a suspicion again about breast cancer, intraductal carcinoma, same breast. But you know what? I'm battling this thing holistically, and I truly believe I'm going to conquer it. I'm not telling everybody go out and just do what I do. I'm just saying what's right for me.
And, part of this becomes there's a balance, right? There's the need for traditional medicine is still patently obvious.
Yeah.
But there's an approach that can involve both. How can you synergize with a traditional doctor in somebody's plan for recovery and for health?
Okay. I say to people, if I get hit by a truck, please don't throw herbs on me. Take me to the emergency room. I want an IV of antibiotics. I'm not stupid, okay? But is that always the first line of defense? Like you said, whether you have any sort of acid reflux or whatever's going on with you, a prescription drug does not heal the body. If you want to mask symptoms and try to keep within that you feel like you're preventing having a stroke or a heart attack, it'll only do so much and go so far. And that's the problem. I don't want to have that kind of false security. I'd rather take supplements like organic whole food B complex, which will nourish and feed the nerves of my heart. And there's a product called cardiotrophin, which is a heart muscle and actually strengthens the heart. So that's what I would rather take. And then I have a great heart graft, and I know I'm not going to, keel over with a heart attack, which I see all the time. A lot of people my age, 60s and 50s, and so forth. So by doing, like I was talking earlier about that heart sound recorder, it's only $50. So to do a test and get it, see where your heart is at, again, it's not to diagnose you, but it's to show you nutritionally what's going on.
Right. And obviously there's that other concept of if you try something, 3, 4, 5 times in a row and you're getting the exact same result, maybe you have to balance it and try other things that may be able to enhance, support, and give you a different approach to solving some of these more difficult, complicated problems. I have a friend who has gone through cancer, and she probably at this point she's had an indication of cancer for a long time, and she found the right person with the right version of CBD and RSOs, and has effectively seen a significant reduction in the size of her cancer cells in this last test.
Amen.
She swears on it.
That's awesome. That's awesome.
But you're not gonna see studies that come back and support that this is absolutely working. So it becomes anecdotal, and it doesn't work for everyone the same way. But the fact that it works for some people means that it's absolutely a worth exploring endeavor.
Well, the way I look at it, George, is doesn't it make sense that if we give the body what it needs, the body's going to heal itself? So if you have cancer, that tells me right off, whatever cancer it is, you're low in your energy. We're all electrical energy. Our bodies are electrical energy. When you're low in your electrical energy, you're going to have cells that go bad. It's as simple as that. They're not being nourished and fed properly. They're not being detoxed properly. So it's like a flower, and you put it in a pot, and you don't put much dirt in it, and you stick it in the corner in the shade, it's not going to grow. But if we put good soil in it, and we give it sunshine, and we give it water, we love on it, that plot's going to flourish. So this is the same type of thing.
And you talk about detox, and there's been a lot of conversations about that, and a lot of diets that go through versions of detox. But same thing, there's a balance question to it, right?
That's right.
How to detox appropriately.
That's right. Exactly. I'll give you, for instance, in the holistic world, people hear about doing a gallbladder flush. Okay. And you use things like apple juice and olive oil and all that kind of stuff. Well, if you don't prepare the gallbladder, which is on your right side under your rib cage, if you don't prepare that gallbladder and you just go in and do this flush, you can make yourself very, very sick. So you say, well, how do I prepare myself ahead of time? I use a product called AF Beta Food. Beta Food is beets. It's beet leaves. And beet leaves are the best thing for thinning bile, because that's what the gallbladder does. It stores bile. That's the whole point of it. And if you don't have a gallbladder, don't think, oh, I don't need this, I'll get away with this. No, you need bile salts. You need to take bile salts to help emulsify fats as you're eating whatever you're eating, especially, butter, olive oil, and things of that nature. And that's even avocados. People don't realize that. That's fat. So you need these things. So again, give the body what it needs. The body will break down what's going on inside. You'll eliminate properly, and you won't end up with dis-ease. That's the whole point, okay? And same with cholesterol. Cholesterol, we need cholesterol. Your liver makes cholesterol, then it goes to the thyroid, and if the thyroid's not working properly, it doesn't get utilized to go to the brain. So now the brain is starving for fat, and our brains are made up of 60% fat. So you see people with really low cholesterol, but they have no brain. They can't remember anything. They don't know where they're going, and then eventually leads to things like dementia and Alzheimer's. So one of the best things for Alzheimer's, they're saying, is coconut oil. And there's great studies on that also, but that's a whole nother subject. But I just want to introduce the idea.
But it's funny you say coconut oil, and I think back to the issue of people swishing coconut oil and
It's oil pulling.
Yeah, thank you. There's the word for it.
Yep.
And without the appropriate research, all of these things can go off the rails. There's got to be a balance, and usually
Absolutely.
Google and YouTube might not be our best teachers.
No,
We
no.
can find ourselves in the wrong spot. So
Yes.
clearly, it's finding the appropriate clinician, the appropriate doctor to go to put up the course of study that works for you, because the same thing that's working for me might not work for you.
Exactly. Coconut oil is very safe. It's, the oil pulling that I just said. What oil pulling is you take like a tablespoon of coconut oil, you put it in your mouth in the morning, swish it anywhere from 5 to 15 minutes. And what it does is it binds the toxins in your mouth and your body a little bit. And then it binds to that. And then you do not spit it down the sink or the toilet, which is what people do, because then it clogs your drains. You want to spit it into the garbage can, okay, like into a Hefty bag or something, whatever. But it whitens your teeth, absolutely. It binds toxins. There's great benefits. Do you do it for a year straight? No, that makes no sense. Okay, so like you're saying, it's that balance of what do I need at this point and what's going on.
How often do you see clients?
Every day.
Right. I'm trying to think of a better way to say that. A client comes in with an issue. What's the follow-up look like? How long does
Yep. What I do is obviously they call, make an appointment. I'm doing what they call now telehealth. I've done phone consultations for 25 years. I have patients all over the world. So it's not a matter of calling it telehealth, but my consultations are an hour. I take a full hour. Sometimes they're an hour and a half. I do not charge any more money. Okay. My consultation is $150. And what I do, I take Visa, MasterCard, and what I do is I have an intake sheet. It's 2 pages. They can fill it out on my website or come in and fill it out, whatever. I make things super easy peasy. Okay. And then, like I say, I go over a conversation. What's going on? Tell me what's happening. I point out some things that I see. I make some suggestions. I put some dots together for them, get some ideas. And then I do the Zyto scan, which always confirms what I've just told them, and which is really awesome. Then I give them an evaluation of what I think they need to do. I give them a couple of supplements. We start out on a program, see how they do. They can call me for free, and I usually go about a week. And then I tell them to call me in a week. I don't call people. And the reason I do that is to put the responsibility on the patient, okay? Because it's their body, it's their health, it's not me. And that's why when people ask me, well, how many people do you cure? I go, nobody. I don't cure anybody. They're like, what? I'm like, it's not my responsibility to cure anybody. What I do is I provide the material, and it's up to you to follow through. I will be your cheerleader. I will help you. I have free follow-ups. I don't charge. Okay. So I'm doing everything to help encourage you to get well. It's up to you to do it.
How do you think your practice has adjusted over the last 4 months? I understand you have telehealth, but how do you think the mental, the physical well-being of your clients has been while we've been dealing with this crisis, with this unknown?
I'm going to tell you the worst part is the mental. There is no doubt about it, and psychological. I've had many phone calls of people that are desperate. And I'll just put it that way. I don't want to go too far with this, but, and again, I try to encourage, be the light, bring them hope, make some suggestions, listen to their problems, so it, like I say, it has a lot of psychological in this as well. This has been hard. I'm in New Jersey. It has been extremely hard. For me, it was really hard in April. Is where I really had probably my hardest point, because I can keep working and I can talk to patients and so forth. But for me to not be able to go out of my house and go anywhere really, really got to me, because I'm a very extroverted, outgoing, but I also had a daughter here with me that was pregnant. So I couldn't, intermingle with anybody anyway. Do you know what I mean? It was really difficult. And I've got a lot of support, but my heart went out. I have a lot of single people live by themselves. And I would check in with a lot of people. I sent a lot of cards to people to try to, again, help encourage them, hang on. This is only temporary, but this has been really hard. And in Jersey, it still is.
With that imbalance, obviously, being the stress and the great unknown,
Yeah.
what are some simple techniques we can do in order to fight back from that, either through foods, through nutrition, through figuring out a new exercise?
Are we talking about COVID-19 particularly, or?
Yeah, sure.
Okay. Okay, because I'm going to tell you, there's a lot you can do for COVID-19. Okay. And again, there's lots of studies. I can, cite them for anybody that wants. I'm not going to do it right now, obviously, but I'm just going to tell you, there's tremendous information that number one, they found the number one problem that with the people that went to the hospital that are going to the hospital with COVID-19 is their calcium is in the toilet. Okay, their calcium levels. Calcium is the most important mineral in your body and the most abundant. And when your calcium is low, you're serious for a heart attack. Okay, because again, your body needs those minerals for everything to work. So calcium was one of the biggest issues. Now, you're not gonna just run out and start taking a lot of calcium or drink a ton of milk, because the problem with calcium is it goes into the gut, and from the gut, it gets picked up by vitamin D, and that picks the calcium up from the gut and puts it into the blood. Well, we're not done. So if you keep taking tons of calcium and that's all you're doing, you're putting tons of calcium into your blood. When you put the calcium into your blood, where does it go? It goes to your teeth for tartar. It goes to your joints for arthritis. And it goes to your eyes for glaucoma, and to your kidneys for kidney stones. So what we need to do is finish the equation, and that is pick up the calcium from the blood and put it into the tissue, okay? Whether it be, again, the heart muscle, prostate for men. The reason the prostate swells is because it's starving for calcium. So how do we pick up the calcium from the blood and put it into the tissues and so forth, is what's called unsaturated fatty acids. So things like cod liver oil, okay? I use a particular one called Cataplex F as in Frank. It's an unsaturated fatty oil. It's a particular product, and that's what it does. But I'll see this on the heart graph. I'll see whether you need the calcium or the unsaturated fatty acids. So that's part of that, the HSR. And now you're picking up the calcium, putting it into the tissues where it belongs. So you need to know the whole equation. So just taking tons of vitamin D, you are not doing yourself any good, especially in the summer when we're getting a lot of sun anyway. You're burning up your vitamins tremendously. So that's a big part of it all. You burn up your unsaturated fatty acids, so the D is actually being harmful, could be in the summertime.
You mentioned tartar and plaque, and that actually kind of leads into that other confusing killer of people, and that would be inflammation. And that's where a lot of our symptomatic issues come from. Why don't you talk about that a little bit?
I'm sorry, can I say one other thing, George, about COVID-19? I said calcium. The other thing that's very high is licorice. Okay, licorice is another big one. Licorice is, there's tons of studies about it, about being super antiviral. The contraindication is people with high blood pressure, but there's I have specific products that would take care of that as well. And St. John's wort is another one. St. John's wort actually breaks the surface protein of the virus, and then the Thuya and licorice go in and kill the virus. So there's a particular product I use for patients. It's called Viranon, and it has those 3 products in it, and it works fantastic. So those are just suggestions. That's just an idea. It's antiviral. So anything that you do for antiviral, like ashwagandha, astragalus, there's herbs, there's all kinds of stuff. But again, you don't want to take a boatload of stuff. It's best to work with somebody that kind of really knows what's going on and suggest to you products, as opposed to going to Amazon and buying stuff, which I would never do anyway, but that's just my opinion.
Well, because you wind up dealing with trace contamination issues. You don't necessarily know where it was made, what other machines, products were on it.
That's right. And one of my big companies, and I won't mention who, it's not their products that are on Amazon. Those are actually made in China, but it comes across as one of the products that I carry. Not a good idea. And it's also more expensive. They charge more than the retail price of this products. I know for a fact. So anyway, so I just wanted to cover COVID-19 a little bit better. Build immune system, vitamin C, critical. Vitamin C, zinc is another big one. C and zinc and antiviral, things for antiviral, which there's a whole boatload of I have.
What about bone broths, and obviously the appropriate versions of bone broths?
Bone broth, yes, excellent, excellent. If you can buy the organic kind of homemade. There's a particular company that I love. Two women make it in upstate New York, and it's fabulous bone broth. You can make it yourself. You go to Whole Foods or whatever, ask them for organic big beef bones and so forth. Put them in a pot, put water in it, turn it on a low heat, and leave it on for hours. Make your own bone broth. It's free. You can throw a little celery in it. You can throw little onions, a little vegetable, whatever. Make your own bone broth. Now you can freeze it.
Makes perfect sense.
I do that.
What about inflammation? And
in my opinion, if you don't bang your knee on the table as you walk by, obviously your knee's going to inflame. And the reason it gets inflamed is because the body's rushing fluid there in case there's any pathogens to take care of it. If we don't have that, we get inflammation from sugar, which is carbs. All carbs turn to sugar. Okay, even protein like meat turns to some glucose as well. But that's another issue. Okay, so your diet is huge, like you said. You should get all your nutrition from food. I don't, because I don't eat all that I need to eat in a day. I kind of pick a little here and there and do a little smoothie, do a little dinner, So in that case also, we need to, go to supplements, and that's what it is. So we need to, support our bodies one way or the other. That's the whole point of it.
Where can people find you?
All over. No, I'm kidding. I'm in New Jersey. Right now, I'm in Red Bank, New Jersey. The best is go to my website. That's the best way to contact me, which is Dr. Sue, S-U-E, Massie, M-A-S-S-I-E, drsuemassie.com. That's my website. It has my email on there. That's a great way of getting hold of me. And I give out my phone number. You'll see my phone number on there, and it will lead you to me.
Awesome.
Yeah.
Is there anything else you'd like to share with the audience?
I'm sorry. We're talking about inflammation.
Yeah,
another point.
Yep.
Inflammation, what I find also has a great deal to do with viral loads. People have viruses, and also bacterial loads. And people are like, I don't have bacteria. I don't have, strep throat, or I'm not sick or whatever. The inflammation from these pathogens is what I call them, comes from other things. So you have things like H. pylori, okay, that's bacterial gut issue. Lyme disease I see all the time, which covers your degenerative neurological diseases. A lot of them are linked to Lyme disease. And I have found this over the years. And again, I will show the scientific data. It's not me just saying it for the last 25 years, like ALS and Alzheimer's and lupus and multiple sclerosis and, all these type of degenerative chronic fatigue, fibromyalgia. Learn the truth of what is going on. And when you learn the truth, then you know how to take care of it. And that's what I want to say about inflammation. Inflammation has a lot to do with infection.
Right. And people have, obviously, when you say bacteria, people have to remember there's good bacteria and bad bacteria. Our bodies need bacteria in order to survive. Right. But you can destroy all of those good bacteria by getting too much into your antibiotics. Absolutely.
Antibiotics means against all life. It's like a nuclear bomb, in my opinion. Now, again, if I have a severe infection, I'm not going to see it. I have antimicrobials, antibacterial, holistic. Sorry, I see my dog moving back here.
It's okay. She wanted to steal part of the show. No, don't hide that. Dogs are good for ratings. Sorry, working at home. Okay, so I use what I call holistic antibacterials, and they work fantastic. And that's a whole nother discussion, but I just want to give you a general of what's available. That's awesome.
Yeah.
What else would you like to share with the audience before we close it up?
Oh boy. What I say, it's okay. My whole thing that I see the most, and I had to learn this myself, you are the most healthiest, the best you can be when you really learn to love yourself. And it's amazing how many people don't love themselves. I just saw a patient and she's like, oh, I'm so sorry. Since I saw you last, I've gained weight. I look horrible. And I'm like, stop. You are beautiful. I don't care about this. She has the most beautiful heart. She's the most kind, loving person. She's a single mom. She's got a lot of problems, that she's just faces boatloads of stuff. And I just, I see this all the time. And I was the same way. I understand this. But when you learn that it's all about love, and love feeds the heart, and when you fill your heart with love, then you give off love. It's like light. You just give off this light to love others. And that's what our purpose is here. You know, when people say, what's my purpose being here on this earth? It's to be about love and light. That's exactly what it's about. And we're here to help one another. So with all that's going on in the world today, with all this craziness, don't listen to that. Turn off the news, learn about yourself, love yourself, and then share that love with others. That's I think the most important thing in this world today.
I think that's a wonderful message to leave everybody with. Dr. Sue Massie, thank you so much for
Thank you so much.
Thank you so much for sharing your time with us today. We really, really do appreciate it. Guys, I'll make sure to put Dr. Massie's information in the link. By all means, reach out to her, ask your questions, find a way to get yourself the help you need.
Yep.
And make sure that you're finding balance and you're finding a way to love yourself throughout all the chaos going on in the world today. And with that,
hey, I give you love. That's also so.
Absolutely. And with that, Veitengruber Law will be back again on Thursday, where we're going to be joined by librarian Kimberly Payon from the Matawan Library, talking about how libraries have kept themselves relevant and active and busy during this crazy COVID period, even though they've been on formal lockdown. So hope to see everybody back here at 3 o'clock on Thursday. Again, this is George Veitengruber signing off, and thanks to you, Dr. Sue Massie, for coming today.
Thank you so much.
In the Matawan Library, wonderful day. About how libraries have kept themselves relevant and active and busy during this